Next thing, you have to look inside the cranial cavity. And when you're looking inside cranial cavity, what do you want to know? I want to discuss some openings there. What openings? There's a question, it is asking, which cranial nerves are there in the posterior cranial fossa? Cranial nerve in the posterior cranial fossa? Yes. I think posterior cranial fossa has brainstem. Okay then. Brainstem has nerve number 3 to 12. So that is the answer. Which one? Actually, you are talking about cranial nerves in the posterior cranial fossa, isn't it? Yes. Then brainstem is there in the posterior fossa. So it gave the nerve number 3 to 12. Are you trying to say the answer is nerve number 3 to 12? Yes. You are correct then. It is. Because they came from brainstem and brainstem is in the posterior fossa. That is the answer. Now, once you have told that, let us remove the brain from the cranial cavity and look at the floor of the cranial fossa. You want to remove the brain from the cranial cavity, look at the floor of the cranial fossa for what? Actually, I want to see anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Oh, like that? Yes. These are the boundaries. Yes. What is there in the anterior cranial fossa? The frontal lobe. And what is there in the middle cranial fossa? Temporal lobe. And what is there in the posterior cranial fossa? That is cerebellum, along with brainstem. So brainstem is in the posterior cranial fossa. Yes. Along with cerebellum. Yes. Okay. Brainstem in the posterior cranial fossa along with cerebellum. Yes, that is the point. Remove them and see the floor of anterior cranial fossa, floor of middle cranial fossa, floor of the posterior cranial fossa now. This is the floor of anterior cranial fossa, and there is a floor of the middle cranial fossa, and this is the floor of the posterior cranial fossa. Okay. What do you want to know there? There I want to know some details, like you will see. At the floor of anterior cranial fossa, yes, cribriform plate of ethmoid bone, which is also roof of the nasal cavity. So cribriform plate of ethmoid bone is also the roof of nasal cavity. Yes. What is the roof of the orbit? Roof of the orbit is this bone, frontal bone. So frontal bone is the roof of orbit, is the floor of anterior cranial fossa also. You can say that. So this is frontal bone, which is roof of the orbit and floor of the anterior cranial fossa. Yes. And this is ethmoid bone, which is the floor of anterior cranial fossa, but also roof of the nasal cavity. Yes. What is this bone here? That's some butterfly shape. That butterfly shape bone. Yes. That butterfly shape bone is actually sphenoid bone. It has a lesser wing, greater wing. And what about the lesser wing, greater wing? Lesser wing is at the floor of the anterior cranial fossa. And where is the greater wing? Greater wing will be at the floor of the middle cranial fossa. So greater wing is at the floor of middle cranial fossa. Yes. And where is the lesser wing? What did you say about the lesser wing? Lesser wing is at the floor of the, and between the two wings there is a fissure. What fissure? Superior orbital fissure. So between the two wings you have some superior orbital fissure. Yes, this we have to discuss. And what is this big opening here? That is foramen magnum. Where? In the occipital bone. Occipital bone. This is all we have to discuss now. And let us do it. So you are now talking about some more details. Yes. Actually, you are looking at the floor of the three cranial fossa. Let us look at them one after the other. We want to talk about the floor of anterior cranial fossa now. Let us magnify. And when you're magnifying the floor of anterior cranial fossa, you will see this is the cribriform plate of ethmoid bone, and it is at the floor of anterior cranial fossa, and it is also the roof of nasal cavity. It is having multiple opening for the passage of the axons of the olfactory nerve, coming from the roof of the nasal cavity, coming to the olfactory bulb in the brain. Axons of olfactory nerve. So what is this bone at the roof of orbit? This bone which is at the roof of orbit is frontal bone. If you say frontal bone is at the roof of the orbit, fine. Actually, there are two bones at the roof of orbit. One is frontal bone. Who is the other one? Lesser wing or sphenoid. So this is the lesser wing or sphenoid at the floor of the anterior cranial fossa. Yes. And the roof of the orbit. Yes. Remember, there are two bones at the roof of orbit. One is lesser wing or sphenoid and the other is the frontal bone. Now this lesser wing or sphenoid, which is at the floor of the anterior cranial fossa and the roof of the orbit, is having one opening which is called optic canal for the passage of optic nerve, which came from the orbit. The eyeball is giving optic nerve. You're telling eyeball in the orbit will give optic nerve? Yes. You're telling that there is eyeball in the orbit giving optic nerve? Yes. And that optic nerve is coming out of the optic nerve. Where is optic canal present? It is in the lesser wing of sphenoid. Lesser wing of sphenoid. So lesser wing of sphenoid has optic canal for the passage of optic nerve here. Yes. Okay, fine. What is this opening in the greater wing of sphenoid then? But if you say opening in the greater wing of sphenoid, then this is not the lesser wing. This is the greater wing. Yeah, okay, fine, greater wing. But tell me, if it is greater wing, then you are not in the anterior cranial fossa. You are at the floor of middle cranial fossa. Yeah, okay, fine. I'm at the floor of middle cranial fossa. But tell me the opening in the greater wing of sphenoid. Opening of greater wing of sphenoid. Yes. Okay, I'll tell you. There are three openings. What are the three openings? You see, this is the foramen rotundum. What is that? Foramen rotundum. So that is foramen rotundum in the greater wing of sphenoid. Yes. And what is this? Oval foramen. Oval foramen. Ovale. Foramen ovale. So that is oval foramen. Foramen ovale. Yes. What is behind that? Behind that is this foramen spinosum. So that is foramen spinosum. Yes. In the greater wing of sphenoid. Yes. Greater wing of sphenoid. Can you tell me what is this? What is this? This is the gap between lesser wing and greater wing. Gap between lesser wing, greater wing. Are you talking about superior orbital fissure? Yes, superior orbital fissure. It is a gap between lesser wing and greater wing. Some nerves are passing, veins are passing. We have to discuss them. Okay, what is this? This is the body of sphenoid at the floor of anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. You are telling body of sphenoid is at the floor of anterior cranial fossa? Yes. Middle cranial fossa? Yes. And posterior cranial fossa? Yes. This is the posterior cranial fossa floor, this is the middle cranial fossa floor, and this is the anterior cranial fossa floor. So body of sphenoid is at the floor of all the three cranial fossa. Yes, it is. Okay, fine. Can you tell me what is this? This is floor of the middle cranial fossa, body of sphenoid. No, that is there. But what is inside there? Pituitary gland. You are talking about pituitary gland? Yes. Okay. You are talking about sella turcica now. Yes, sella turcica. Remember, sella turcica is body of sphenoid at floor of the middle cranial fossa to keep pituitary gland in the midline. So sella turcica is in the body of sphenoid at the floor of the middle cranial fossa to keep the pituitary gland. And now do one thing. What? Pull the sphenoid bone from the floor of the middle cranial fossa. So from the floor of middle cranial fossa, I'll pull the sphenoid bone out. Yes. Why? Because there are some questions on that. What questions are there on that? Tell me. Let's do it. at floor of the middle cranial fossa to keep pituitary gland in the midline. So sella turcica is in the body of sphenoid at the floor of the middle cranial fossa to keep the pituitary gland. And now do one thing. What? Pull the sphenoid bone from the floor of the middle cranial fossa. So from the floor of middle cranial fossa, I'll pull the sphenoid bone out. Yes. Why? Because there are some questions on that. What questions are there on that? Tell me. Let's do it. We're pulling the sphenoid bone out from the floor of the middle cranial fossa so that you can discuss it. What do we want to discuss? You see, this is the optic canal. I think optic canal is in the lesser wing of sphenoid for the passage of the optic nerve. Yes, it is. And what is this? Opening in the greater wing of sphenoid. Opening in the greater wing of sphenoid. I know. This is foramen rotundum. This is foramen ovale. This is foramen spinosum at the floor of middle cranial fossa. And what is this gap? What gap? This gap. This gap between lesser wing, greater wing. Yes, that is the superior orbital fissure. And what is this? What? This is the pituitary gland. No, like where do you keep pituitary gland? In the body of sphenoid. Where in the body of sphenoid? That is sella turcica, sella turcica. And what is lateral to that? Sella turcica. Lateral to that sella turcica. It is lateral to pituitary gland. Yeah, what is lateral to pituitary gland? I think some artery. What artery? Internal carotid artery. Where? In the cavernous sinus. Correct. So that is the area of cavernous sinus, and inside cavernous sinus you have the internal carotid artery, which is lateral to the pituitary gland. Let us come back to our diagram and discuss it there. Which diagram? The one which we had there. But before that diagram, just look at the front view of the same bone. Which bone? Sphenoid bone. Front view sphenoid bone, like this. Yes. We are talking about the boundaries of the orbit here. Boundaries of the orbit. So when you talk about the boundaries of the orbit, you are looking at the front view of the sphenoid bone. Front view means front view. Yes. What was the earlier? Earlier was superior view. And this is front view now. Yes. Okay, front view. Show me the front view. You see, this is the sphenoid air sinus. Sphenoid air sinus means the sphenoid bone is a pneumatic bone. Yes, it is pneumatic bone. This is sphenoid air sinus. Okay, then. You remember that there was a lesser wing of sphenoid, roof of the orbit? Yeah, I know. Roof of orbit, lesser wing of sphenoid. Now remember, the greater wing of sphenoid. Yes. The greater wing of sphenoid will form the, lateral wall of orbit. Lateral wall of orbit. So you are looking at orbit from like this. Yes, lateral wall of orbit. And between the lateral wall of orbit and roof is superior orbital fissure. Oh, you are telling lesser wing of sphenoid is the roof of orbit. Yes. And greater wing of sphenoid is the lateral wall of orbit. Yes. And between lateral wall of orbit and roof is some superior orbital fissure. Yes. This is superior orbital fissure, which is between lesser wing and greater wing of sphenoid. And greater wing of sphenoid is lateral wall. Yes. Of the orbit. And the roof is, so what is between the two? Superior orbital fissure. Okay, then you remember body of the sphenoid. Yes, body of the sphenoid is medial wall of the orbit. Medial wall of the orbit. You are telling that sphenoid bone has 3 contributions to the orbit? Yes, remember body of the sphenoid is medial. So body of sphenoid is medial wall of orbit. Yes. Roof is the lesser wing of sphenoid. Yes. Lateral wall is greater wing of sphenoid. Yes. What are the other bones contributing to orbit? That we'll discuss later. Just remember this. Body of sphenoid is medial wall of orbit. Roof is the lesser wing of sphenoid. Lateral wall is the greater wing of sphenoid. Now the sphenoid bone from the front view, you are seeing. Look at this pterygoid process. What is that? Pterygoid process. And this pterygoid process is like the giving some muscles. What muscles? Which muscles are you talking about? Actually, there will be a muscle coming from lateral side. and one will come from medial side. What is this muscle coming from lateral side, medial side? What is this muscle coming from lateral side, medial side? If the muscle is coming from the medial side, it will be medial pterygoid and lateral pterygoid. Yes. Are you trying to say lateral pterygoid and medial pterygoid come from pterygoid plate of the sphenoid bone? Yes. Medial pterygoid from medial surface, lateral pterygoid from lateral surface. But this is the origin. What is the insertion? Insertion must be the mandible. They move the mandible. They are muscles of mastication. So lateral pterygoid, medial pterygoid will move the bone mandible for mastication. Yes. Yes. Okay. So they move whichever bone is moving, that will have insertion, and whichever bone is static will be the origin. So sphenoid is origin. Yes, we'll see that later as well. At this moment, let us just continue further. Further with what? You have taken this bone from the floor of the middle cranial fossa. Yes, go back to the middle cranial fossa floor. So you want me to go back to the floor of the middle cranial fossa now? Yes. Okay, that is where you have the internal carotid artery inside the cavernous sinus lateral to pituitary gland. This is the diagram which we continue with now, and it is here. See, this is the place where you have cavernous sinus, and which is lateral to the pituitary gland, and that is where you have this artery. What is this? Internal carotid artery. So you are telling this is internal carotid artery which is becoming the content of the cavernous sinus now? Yes, it is passing at the floor of the foramen lacerum. What is this? Foramen lacerum. You are trying to say internal carotid artery will be passing at the floor of foramen lacerum before it enters the cavernous sinus? Yes. Can you show me foramen lacerum in the diagram which we were using earlier? Yes, but remember, this is the internal carotid artery which will be passing at the floor of foramen lacerum before entering the cavernous sinus. So this is foramen lacerum. Yes. Can I see the foramen lacerum medial to foramen ovale? Yes, medial to foramen ovale. Medial to foramen ovale. Let us go back here. This is foramen lacerum. It is called so because it has lacerated margin. So this is foramen lacerum, called so because it has some lacerated margin. Yes, and it is lying medial to foramen ovale. Medial to foramen ovale. So medial to foramen ovale with lacerated margin. That is where the internal carotid artery was passing. Yes, it goes like this. So where is it going? Into the cavernous sinus. It is passing at the floor of the foramen lacerum to enter the cavernous sinus. Okay, fine. Can we discuss the posterior cranial fossa now? Yes, let's do that. Floor of posterior cranial fossa. Magnify. When you magnify the floor of posterior cranial fossa, you will see this is what? This is the internal auditory meatus. If you say that is the internal auditory meatus, fine. Where it is? In the petrous temporal bone. Petrous temporal bone. So petrous temporal bone where you have middle ear cavity. Yes, middle ear cavity. Petrous temporal bone. There you have middle ear cavity, and the facial nerve will enter through the internal auditory meatus. So facial nerve pass through internal auditory meatus into middle ear cavity. Yes, we'll see that later. What is this below that? Below that is jugular foramen. Below that is the jugular foramen. So below that is the jugular foramen. That is the middle ear cavity. Yes, that was middle ear cavity. This is jugular foramen, and there is one more opening now. What is that opening below that? See, you have to understand that there is one opening here, there is one opening here, and there is one opening here. What is that third opening then? That is called as hypoglossal canal, for the passage of hypoglossal nerve. So telling that this is middle ear cavity. Yes. That is the jugular foramen. Yes. And this is the hypoglossal canal. Yes. For the passage of hypoglossal nerve, 12th nerve. Yes. Then what is this large opening? That large opening is foramen magnum in the occipital bone. If that is the foramen magnum in the occipital bone, fine. Let us discuss what are the structures passing through foramen magnum and the other openings. Like this is the middle ear cavity, that is the jugular foramen. There you told some hypoglossal canal, all that I have to discuss in the posterior cranial fossa. Okay, then discuss. You have to look at some of the cranial nerves passing various foramina. And which are they? To discuss them, we will look at some diagrams and then draw the diagram. So first you see the diagram, then you draw the diagram. Yes. Which diagram? Actually, I have removed the brain from the cranial cavity. So I can see some cranial nerve passing through the various foramina. Which cranial nerve you are talking about? See here. This is the what? Roof of the nasal cavity, cribriform plate of ethmoid bone, olfactory nerve coming to synapse in the olfactory bulb of the brain. Olfactory bulb of the brain. So that is olfactory bulb of the brain. Yes. Okay. Can you tell me what is this nerve coming from the eyeball? Of course, this nerve which is coming from eyeball is optic nerve. Passing this optic canal. Where? In the lesser wing of sphenoid. What is this? This is the pituitary gland in the sella turcica. Pituitary gland in the sella turcica in the midline. And what if it is having a tumor? Then you will have problem of optic chiasma, bitemporal hemianopia. Temporal vision is gone, only tunnel vision is remaining. You are telling that if there is a midline tumor of the pituitary gland, then there will be optic chiasma compromise. Yes, optic chiasma. So the peripheral vision is gone. Yes. Tunnel vision, the nasal vision is working. Yes. Okay. Can you tell me what is this? Dark color? Dark color. You don't know dark color? That is a substantia nigra in the midbrain. Okay, midbrain. Fine. Where is midbrain present? In the posterior cranial fossa. This is in the posterior cranial fossa. What is it giving? What is it giving? You don't know. This is oculomotor nerve coming anterior. So oculomotor nerve coming anterior. Yes. Okay. At the level of which colliculus? At the level of which colliculus? Superior. And what is this colliculus below that? That must be inferior. So that is inferior colliculus. Yes. Below the superior, you have inferior colliculus. What is this? Four bodies together. Four bodies together. Corpora quadrigemina. Corpora quadrigemina. And what is this opening here? That opening is aqueduct of Sylvius. Aqueduct of Sylvius. Okay. Can I see some more details here? Some more details you want? Yes. Okay. Then let me show you the other details. You have to look into the middle cranial fossa and posterior cranial fossa now. So why should I look at there? Because these days examiner will give you a computer and computer based test. So some dissected specimen and you're looking, what is this now? Because marker A, B, C and D. So you have to identify. Means I have to train myself to identify. Yes, that's what you're doing. Okay, let me do it. I think this will be the area of cavernous sinus. Yeah. There are some nerves inside cavernous sinus. Yes. Formula of the eyeball. What is the formula of the eyeball? It is the number 3. And it is the number 4. And it is the number 6. What is this? The number 3, 4, 6 going to become a content of cavernous sinus. Yes. Where is the number 3? The most medial. Then where is the number 6? In the middle. And where is the number 4? The more lateral. Not very clear here? No. We'll see the diagram later also. Okay. Where is the fifth nerve? Fifth nerve. You will see the fifth nerve is having a ganglion at the floor of the middle cranial fossa. Trigeminal ganglion. Yes. So this is trigeminal nerve. Yes. Having trigeminal ganglion at the floor of the middle cranial fossa. Yes. Okay. Can you tell me what is this nerve here going into internal auditory meatus? 7 and 8. 7 and 8. Can you tell me which nerves are in the jugular foramen? Jugular foramen. The number 9, 10, 11. 9, 10, 11. Then where is the 12th nerve? Here. This is the hypoglossal canal. And what is there in the foramen magnum? Foramen magnum, you don't have the spinal cord. Then where is spinal cord? Below the foramen magnum. If you say spinal cord is below the foramen magnum, then what is there in foramen magnum? Actually, it is, if you say foramen magnum, there you will have the lower part of medulla oblongata. Lower part of medulla. So in the foramen magnum, you have lower part of medulla oblongata. Yes. What are the other things. Actually, this diagram which you see has some other details also, like see, this is the vertebral artery coming to enter the cranial cavity, forming basilar artery, and this is the internal carotid artery, where in the cavernous sinus, it has come out of cavernous sinus. And who is this? That is the optic nerve. And then who is this? That is the olfactory tract. So all these things are there? Yes. But these things are not very clear? No. So we want to see a clear picture now. Understand, there is one nerve which is coming from, there's a nerve which is coming from spinal cord and enter the cranial cavity and then exit the cranial cavity. Who is this nerve coming from spinal cord, enter the cranial cavity, exit the cranial cavity? That is called as spinal accessory nerve. Spinal accessory nerve. Now let us have some good diagrams to discuss all that. And which good diagram you are talking about? Here. This is the diagram, same diagram. Yes. This is a good diagram. Yes. Because things are more clear. Okay. Repeat information. Yes, it is. See, this is, I'll magnify. What do you think this is? This is olfactory nerve piercing cribriform plate of ethmoid. Then what is this? This is the optic nerve coming from optic canal. Then what is this? This is the internal carotid artery. If you say this is internal carotid artery, fine. It is inside cavernous sinus here? Yes. Then which nerve is more medial? That is oculomotor. And which nerve is this and this? That is actually abducent. That is abducent, sixth nerve. So how do I identify abducent nerve? Remember, abducent nerve is going to puncture durameter at the floor of posterior cranial fossa. Abducent nerve is going to puncture durameter at the floor of the posterior cranial fossa to become intradural. It has the longest intradural course. Later it will enter the cavernous sinus. But remember, abducent nerve will puncture the durameter at the floor of the posterior cranial fossa, become intradural, and it has the longest intradural course while it is running inside the cavernous sinus also. Which is the lateral most? I told you lateral most. Trochlear is lateral most. If trochlear is lateral most, which is the most medial? I told you. Most medial is the oculomotor. So oculomotor is most medial. Yes. And trochlear is most lateral. Yes. And then you are telling that abducent was somewhere in the middle. Yes. Who is this nerve here? Forming some ganglion at the floor of middle cranial fossa. That nerve is the largest cranial nerve and trigeminal nerve. So you are telling that this is the largest cranial nerve, trigeminal nerve, forming some ganglion at the floor of the middle cranial fossa, given three branches, namely 5-1 the ophthalmic nerve, yes. 5-2 the maxillary nerve, yes. 5-3 the mandibular nerve, yes. Who is this? This is the thinnest cranial nerve. Who is the thinnest cranial nerve? Trochlear nerve. Why trochlear nerve is thinnest cranial nerve? Because it has very few axons. And why the trigeminal nerve is thickest cranial nerve? Because it has large number of axons. And who is this nerve going into the interauditory meatus posterior cranial fossa? If you say this is the posterior cranial fossa, interauditory meatus, must be nerve number 7-8, nerve number 7-8. And who is in the jugular foramen? It is nerve number 9, 10, 11, and also the spinal accessory nerve. So you are telling that in the jugular foramen, you have nerve number 9 to 11, spinal accessory nerve coming from spinal cord. Yes. What is there in the hypoglossal canal? If you say hypoglossal canal, then 12th nerve. That is 12th nerve. And who is this here? If that is 12th nerve, fine. Who is this here? That is the spinal cord, and it is not in the foramen magnum. It is below the foramen magnum. It was giving this nerve which will enter the cranial cavity and exit the cranial cavity. Who is this nerve? That is the spinal accessory nerve. How does it enter the cranial cavity? To enter the cranial cavity is past the foramen magnum. And how does it exit the cranial cavity? Passing the jugular foramen. It will stay inside the cranial cavity for a short distance. So the spinal accessory nerve will stay in the cranial cavity for a short distance, and then it will exit the jugular foramen. Yes. That you remember. Okay. So these are the details which you wanted to know. Yes, because examiner is asking all that. Can you see the pituitary gland here? In the sella turcica? That is pituitary gland in the sella turcica. That is pituitary gland. Sella turcica. Pituitary stalk. Pituitary stalk. Okay, fine. Once you have told all that, fine. Let us quickly go through the details in this diagram also. So for some good idea, you will magnify this area and quickly tell this is the olfactory nerves coming from the roof of the nasal cavity. This is the optic nerve coming from the optic canal. This is the middle cranial fossa floor, where you will find the cavernous sinus. Inside the cavernous sinus you have some nerves, and they were the formula of the eyeball, number 3, 4, 6. Can you tell me which is the most medial? Most medial is the number 3, oculomotor, and which is in the middle. A nerve which is puncturing the dura mater at the posterior cranial fossa. You mean to say abducent? Yes, abducent. And then longest intradural course. And which is the most lateral? That is the thinnest cranial nerve, trochlear nerve. Thinnest cranial nerve, trochlear nerve is most lateral. So number 3, 4, 6. Yes. Supplying the eyeball. Yes. Content of cavernous sinus. Actually, they came from the brainstem in the posterior cranial fossa. Now, number 3, 4, 6 came from the brainstem in the posterior cranial fossa. Content of the cavernous sinus. Now, they'll pass through the superior orbital fissure here, passing superior orbital fissure here, and then enter the orbit to supply the eyeball muscles later. Okay. You will now look at this trigeminal ganglion. Where? At the floor of the middle cranial fossa. If you say this is the trigeminal ganglion at the floor of the middle cranial fossa, this is the thickest cranial nerve? Yes, it is. The trigeminal nerve is the thickest cranial nerve. This is the trigeminal ganglion at the floor of the middle cranial fossa, giving 3 branches, which are 5, 1 to 3. If you say 5, 1 to 3, then which are content of cavernous sinus and which are not? You see, 5-1, which is called as the ophthalmic nerve, is a content of the cavernous sinus. Before, it will give 3 sensory branches to pass superior orbital fissure. So you're telling that 5-1 ophthalmic nerve is a content of cavernous sinus? Yes, it is. And then it will give 3 sensory branches passing the superior orbital fissure? Yes. What are the 3 sensory branches giving to the past the superior orbital fissure? That we'll discuss later. At this moment, this is 5-2. What is 5-2? That is the maxillary nerve, which is passing foramen rotundum before supplying the bone maxilla. So we're telling that this is 5-2, the maxillary nerve, which is passing foramen rotundum to supply the bone maxilla. Yes, but before it supply the bone maxilla, it has to pass the foramen rotundum. Then what is 5-3? 5-3 is mandibular nerve going to supply the bone mandible, but before it reached the bone mandible, it would have passed through foramen ovale. So mandibular nerve will pass foramen ovale. Yes. To supply the bone mandible. Yes. Is it the content of the cavernous sinus? No. Oh, you are telling mandibular nerve is outside the cavernous sinus. Yes. Then who is inside the cavernous sinus? Only 5-1-2. So only 5-1-2 are content of cavernous sinus. Yes. And some people, remember, maxillary nerve can be outside cavernous sinus. So you're telling that maxillary nerve may or may not be content of cavernous sinus? Yes. Then who is always a content? Ophthalmic nerve. So ophthalmic nerve is always a content of cavernous sinus? Yes. And maxillary nerve may or may not be content of cavernous sinus? Yes. And mandibular nerve is never a content of cavernous sinus? That's the point. Mandibular nerve is outside cavernous sinus and maxillary nerve is inside cavernous sinus, but in some people it may be outside cavernous sinus, and ophthalmic nerve is always a content of cavernous sinus. Are they inside the cavernous sinus or not? Yes, they are. According to Harrison medicine, they are. Both of them are content of cavernous sinus. Then what is Gray's anatomy telling? Gray's anatomy is telling some controversial statement. Okay, we'll discuss that later then. What about the posterior cranial fossa? What did you say? Posterior cranial fossa we have discussed. Now number 7-8 passing internal auditory meatus. Now number 7, 8 passing internal auditory meatus, and what is the number 9, 10, 11 passing? Now number 9, 10, 11 passing jugular foramen, and where is the 12th nerve? 12th nerve is not here. 12th nerve is hypoglossal nerve in the hypoglossal canal. So 12th nerve, hypoglossal canal. Then what is this? This is the spinal cord below the foramen magnum. If you say this is the spinal cord below the foramen magnum, then what is there in the foramen magnum? In the foramen magnum, you don't have the spinal cord. It is lower part of medulla oblongata. Okay, what is the spinal cord giving? Spinal cord is giving spinal accessory nerve, which will enter the cranial cavity and exit the cranial cavity. So how will it enter the cranial cavity, exit the cranial cavity? Actually, spinal accessory nerve entry point is foramen magnum and exit point is jugular foramen. So you're telling that this spinal accessory nerve will stay inside the cranial cavity for a short distance? Yes. It is entering at the foramen magnum and staying short distance in the cranial cavity and exiting cranial cavity, passing the jugular foramen, taking a U-turn. Here it is taking a U-turn. We'll draw a diagram for that later. It is taking a U-turn there.